all about Love Your Heart. Welcome to New Day Cleveland. I'm David Moss, and Natalie joins me along with
Dr. Mark, the one and only Marc Gillenov from the Cleveland Clinic. He is joining us today along with a team of cardiac care, world-renowned doctors. They're going to tell us about our heart, answer questions we need to know, and who could miss this big mega heart behind us?
Well, he just compared himself and the staff in the Cleveland Clinic to the New England Patriots, and I thought that was pretty good.
Yeah, we always win, but we never get behind in the first half.
Which we
got a
all
lot less drama.
can rest easy knowing, that is for sure.
I love it. So we're standing in an area that could be called a heart attack in some cases, huh?
Yeah, this is a giant heart. Our own hearts are about this big. The key part of this is heart muscle, and this is an artery on a person's heart. A heart attack, this is what we need to avoid. A heart attack occurs when one of these arteries gets blocked. This artery is blocked, no blood flow to the heart muscle, and you get part of the heart muscle right here dies. That is a heart attack. We're going to go inside the heart, and then we're going to tell you more about the rest of the show. How do you prevent a heart attack? How do you keep this artery open? Want to go inside?
Yeah, let's go inside.
Can I just make sure that Medical Inflatables brought this here, and we really appreciate them doing that. And while you guys go into the heart to explore, we want to make sure that you ask questions you might have for Dr. Mark. Just email us at newday@fox8.com. He's going to email your questions later on in the show and discuss them. All right, take your little tour, David.
Okay, so here's the guy who's usually on the outside of the heart, but once in a while he reaches inside the heart. Now we get a chance to go inside the heart.
So we're going to have a look inside. This is the right atrium. Right in here, this is where blood comes from the body, from the vena cava. Deoxygenated or dark blood comes into the right atrium, a collecting chamber, and passes through the tricuspid valve, which looks a little like this. I repaired a couple of them yesterday. Pretty good representation.
So when one goes bad, what goes bad with something like this?
What happens is the valve leaks. It gets stretched out, and actually this one is stretched out. We need to fix this baby up sometime. But for now, we'll pass from the right atrium through this valve. Valves are like doors in the heart, into the right ventricle, which is this chamber. The ventricles are the lower chambers of the heart. They're very muscular. They pump the blood. The right ventricle, this one, pumps the blood to the lungs. And you see the right ventricle's got a little light show going on. This represents the electrical activity of a pacemaker. When someone gets a pacemaker, when an electrophysiologist, kind of cardiologist, puts a pacemaker into the heart, he or she puts wires into the right ventricle that send impulses that pace the heart, keep your rhythm going.
So if somebody has like an AFib problem or something like that, that's what you do for that?
If they needed a pacemaker, they'd have a wire looking something like this going into the right ventricle, sending impulses to make that contract with a good rhythm.
So it looks like somebody's got a rash down here.
That represents an infection, endocarditis, which is when you get a bacterial infection of a heart valve. And this can occur in people who have heart valve abnormalities who go to the dentist and don't take antibiotics.
Whoa, that's what it's all about.
Yeah, so these are people who already have heart valve abnormalities. Most of us don't need an antibiotic with the dentist, but if you have a heart valve problem, you do, so you don't get that infection for me.
This heart valve thing we're talking about as we came in, that's not something you can do anything health-wise to fix. That's more of a genetic problem?
Genetic or acquired, but doesn't relate to your diet or exercise or any of that kind of stuff. Now, I was going to tell you, here we've got something abnormal. We have a hole in the heart. This is called a ventricular septal defect. Not normal. Some babies have them, and we fix them. The reason we have it here is so that you and I can get to the left side of the heart.
Come on.
So come on over. This is the left ventricle. This is the main pumping chamber of the heart. When you put your hand over your heart and say, I pledge allegiance, you are feeling the left ventricle, this big muscular chamber squeezing. The left ventricle sends all the blood out to the body. Every drop of blood that gets out to your heart, your lungs, your brain, your kidneys, goes through the left ventricle and through this valve, the aortic valve. If this aortic valve goes bad, we usually have to replace it, and we put in pig valves, cow valves, sometimes metal valves. The other valve in the left ventricle is the mitral valve. If someone has mitral valve prolapse, this valve gets a little floppy and can leak, and this is the one we can repair most frequently. So this is a mitral valve. If we do have to replace a valve, we have cow and pig valves. We also have mechanical valves that look like this.
You can actually hear those when people have them.
These make a little bit of a clicking noise. The reason I wouldn't personally want one is I'd be afraid that might drive me nuts.
Oh, because if you go trying to go to sleep, you could probably hear it.
And then we can step outside the heart.
It looks like the basement and the garage of Channel 8.
It is something like that. And up here you see all these gigantic arteries, pulmonary arteries that carry blood flow to the lungs. Aorta carries blood flow to the body. The heart's end game is send the blood, pump it out into these arteries to your lungs and body.
So when somebody has like a bypass surgery, it's 1 or 2 or 3 or 4 of these kind of things on the outside?
Yeah, the bypasses and stents occur for the arteries on the outside of the heart. When they get blocked, we fix those.
This is unbelievable. So this is fantastic. So this heart, you say the human heart's about this big.
Yeah, it's about like 2 of your hands together.
Your hands.
So this is a little bit bigger, 15 feet tall or so.
So this gives you a little perspective.
Yeah.
That's a funny inflatable, I'll tell you that.
Yeah.
Well, coming up in the show, we're going to talk about a lot of things. We're going to talk about triglycerides, we're going to talk about cholesterol, we're going to talk about a healthy diet, all the things we know and need to know that'll help us stay healthy.
Yeah, you want to keep this thing beating. 3 billion beats in a lifetime, starting with right now, keeping it going.
That's a big number. We'll find out more about that after the break.
Welcome back to New Day Cleveland. Did you know Americans are more likely to know their bank account balance than their blood pressure, LDL cholesterol, and body mass index? Well, it seems pretty reasonable when I think about it that that could be the case. So we have Dr. Marc here once again, and also I have Danielle here, who is a nurse at the Cleveland Clinic, to talk about, first of all, how you can find out how at risk you are for heart disease. And this is potentially life-saving information here. So you're going to want to listen in. Information that can prevent heart attacks. So the big question is, what do we need to know? And he always yells at me and says, you need to know your numbers. So I'm going to start by having Danielle help me know at least my blood pressure numbers. And that's very important, right?
Well, I would never yell at you.
Yeah, that's true. He doesn't yell, but he does sternly tell me it is very important.
Yeah, and I'm guessing your blood pressure is going to be.
Well,
I'm going with.
I'm nervous now, but
115 over 75.
115 over 75?
That's what I'm guessing. 120 over 80 is the number you're looking for, that or lower. Now, some people have what's called white coat hypertension. They see someone with a white coat and their blood pressure shoots up. I'm betting, you seem very calm to me, so I'm betting
I don't know, Dr. Marc's
A-okay.
in my presence. White coat syndrome might happen right now.
I'm wearing my white coat, but it's got no effect on you, I guarantee.
We'll
The
see.
thing about blood pressure, though, is when people have high blood pressure, they don't feel anything in particular. There are no symptoms associated with high blood pressure. So the only way to know your blood pressure is to measure it, and you can buy it at the drugstore, supermarket, your own blood pressure cup, or just go to a doctor or nurse and see what you've got.
Well, let's see here. I always feel like I shouldn't talk while they're doing this.
Oh, you're
Is it
allowed to
okay?
talk, yeah.
I remember trying to do this when I was in 9th grade when we had to take blood pressure. I couldn't hear a thing, so I'm impressed.
Well, the newer devices you can buy at the supermarket or drugstore.
A
you
lot
don't need
easier?
Yeah, you don't need a stethoscope. What do we get?
What do we have?
130 over 96.
Oh,
130 over
jeez.
96.
It's never been that high in my life. It's the nerves, I think, right?
I think it's my fault.
It's your fault.
It's surrounded by.
It's never been that high. I said, make sure we tell them the exact honest number. So what is more important, the top number or the bottom number or both? The systolic, diastolic?
They're both important, and you really want to shoot for 120 over 80. So what just happened with you is super common. It's probably the situation, the white coats and everything
We got a lot
made the
going
blood
on
pressure a little higher.
today.
So here's what you need to do. Get yourself one of these blood pressure cuffs, test it a couple evenings just before you go to bed, 2 or 3 straight nights, things are quiet, you're relaxed. I will bet you I'm going to wind up right. 115 over 75. Those are the numbers I'm choosing for you.
I think the last time I had mine done, it was 118 over 70 something. So I should be okay. So looking at these numbers that we just saw there on the screen, the top one should be around that, what,
120 or less.
Or less.
Yeah.
Okay. Now, how important is it to know that number, and how often should you be checking your blood pressure then?
For people who have high blood pressure, very frequently with a doctor and at home. But for someone like you, where you're going to wind up with a great blood pressure, just once a year to check it.
Okay, so these are the stages here, basically, that we're looking at right now?
Yes.
So stage 1, that is would someone in stage 1 need medication or no?
We would start with lifestyle modification. If you've got stage 1 high blood pressure, or what we also call hypertension, if you exercise, if you're overweight and you lose weight, though if you limit salt in your diet, those are probably going to do the trick. If they don't, then the person should not be afraid of medicines.
Okay, so this is then when we start talking about this hypersensitive crisis. If you're higher than 180 over 110,
Yeah.
you need to get to see somebody.
This needs treatment, and this can cause real problems. People may have symptoms when it gets this high, headache, feeling faint, and that requires treatment early.
And when you say treatment, just possible medication or getting to a hospital? And
Yeah, getting to a hospital, and it's going to be medication.
Okay.
Blood
it's not
pressure
that
is easy.
scary to take care of. You can manage it very easily.
The scary part is not knowing. The riskiest thing a person can do with blood pressure is ignore it.
Now, cholesterol is the one thing that also, I think it's that necessary evil that we all have to address.
Yeah, this is one of the numbers you need to know. Know your bank account, know your social security number, know your blood pressure, and know your cholesterol. But not just cholesterol. Know your LDL cholesterol. If I go get a blood test now for cholesterol or lipids, they're going to give me a bunch of numbers. And I'm going to focus on one of them at the start, my LDL or bad cholesterol.
So what is our goal for cholesterol?
Goal is 130 or less, and even lower for people who have vascular disease. If someone's had a stent or has a blockage, had a heart attack or a stroke, you want it less than 70.
You brought up lipids. I know that is basically triglycerides. We're going to be talking about that more in the show. I know that, but before we get to that, I just want to also quickly mention your BMI. You said that is something you should know, and anytime I've ever had it done is when I've gone into a gym for the first time and they want your starting point. But you hate having to know that number too, but it's a necessary evil as well.
I'm sure for you it's fine to know. BMI is easy. No trip to the doctor necessary. Get on your computer, go to Google, search BMI. It will ask you, input your height, input your weight, and the number pops out. What number do you want? You want that number 25 or so, 25 or less. Don't want in the 30s.
Okay, so but using that calculator online is safe. It is pretty accurate then.
Yeah, it's easy.
Okay, all right, I like the sound of that. And hey, this man has a lot of great information for you. You know that. So if you have any heart questions that you would like to ask Dr. Marc throughout our hour, again, we want to remind you to email us at newday@fox8.com. We'll get to as many questions as we possibly can. This hour is just getting started. Dr. Marc, thank you very much for the moment. David, I'm going to send it back out to you.
It's time to meet the cardiologist. That's right. Dr. Christine Jellis is here from the Cleveland Clinic. And we talk about, you talk about heart surgeons, Dr. Marc, cardiologists. What's a cardiologist do?
Sure, so thanks for having me today.
Thank you for being here.
We're specialist physicians with a subspecialty training in cardiology, so all aspects of the heart. A lot of us have interest areas in particular areas of cardiac medicine, and we work closely with our surgical colleagues who go on and perform a lot of these operations. But you'll often see a cardiologist first before you go on and see the surgeon.
You guys are almost like the detectives and the explorers and figure it all out before you have to see a surgeon.
Exactly, and I often say to my patients, I'm the detective. We need to figure out what's going on with you.
How about that?
Yeah.
So it seems like when people talk about heart problems, they're always talking about cholesterol. And then they say, Americans are all fat people. Being from Australia, you might be able to address that. But they also say we have the highest cholesterol. Is that true?
Look, I think it's one of those myths about cholesterol. In the States, about a third of us have high cholesterol, but overall, internationally, we're middle of the road. So we're not actually the worst out of the whole world, and I think the Europeans sometimes take that title. But we can always do better, and it's certainly a big risk factor for heart disease. So we're very proactive, particularly in this heart month, about asking people to have their cholesterol checked and trying to optimize those levels.
I know a lot of people try to maintain the cholesterol through exercise, but also through diet. And I know for a long time, people always say you got to stay away from eggs.
Yeah, the poor old egg has really had a lot of bad press. And it's true, eggs, and particularly the egg yolk, is quite high in cholesterol. It's about 2/3 of the recommended daily cholesterol dietary intake. But there's also some evidence that shows that eggs can help good cholesterol, and that in moderation, they're not a bad thing. So we can generally say to people, 1 or 2 eggs up to two or three times a week is fine.
Yeah, I remember old timers telling me years ago that cholesterol is like the yolk is high in cholesterol, but the white sort of compensates for it, and then it sort of balances itself out. But there's still, you can't overdose on eggs.
Well, I think in moderation, that's always the
Everything
key.
is moderation.
Everything in moderation.
Everything.
But eggs are a great source of protein too. So we've got to remember that there are good aspects to egg intake, and overall a balanced diet is what we should all have.
And you bring up the point also that this egg, if you eat it right in the right quantities and all that, can boost the good cholesterol. So, you know, we always talk about keeping our numbers low, but you really like that good cholesterol to be high.
Absolutely, and there's the total cholesterol, but then within that there's the good cholesterol and the bad cholesterol. People will have heard of the LDL being the bad cholesterol, the HDL being the good cholesterol. So it's important to get that ratio right and eat foods and do exercise in general, overall look after our well-being to try and improve that ratio.
Yeah. So I had high cholesterol. I take a bunch of medication for it. I've even had surgery to correct some things.
Yeah.
So my kids, should I be thinking about my kids and cholesterol? Is it too early to think about that?
Look, I think it's never too early. There certainly are genetic factors that can cause people to have elevated cholesterol in addition to diet and poor exercise and weight and those sorts of things. And I think it's important for those of us with small children to try and instill in them good behavioural aspects that they can then carry on for the rest of their life. And in some cases, if a younger child is overweight, has high blood pressure or very strong family history, there may be a reason that they should have their cholesterol actually checked.
So if your child you find out has high cholesterol, are you thinking that, I mean, you go for the diet, or are you trying to do the exercise, or is there actually a statin treatment for that?
I think always, especially with children, diet and exercise, for all of us, diet and exercise is the number one treatment.
Right.
For kids, getting them outside, doing as much as they can, and then things like fibre, making sure they have a high fibre diet also helps with their cholesterol and their dietary intake.
So we have to get the kids out of their phones, off their computers, away from the TV, and maybe get outside and run around a little bit.
Absolutely. On a day like today, get outside and enjoy this lovely weather.
And I think you're less likely to be eating potato chips running around outside than you are in front of the TV, right?
Absolutely.
Great. Thank you very much.
That's my
Dr.
pleasure.
Christine Jealous from the Cleveland Clinic, cardiologist, and we're going to continue with Love Your Heart. And in the future here in the show, we're going to talk about how emotions affect the heart. So we're going to get a lot more information. That's coming up after the break. Thank you.
Thank you.
Welcome back. Well, here is something to think about. 88% of Americans don't know that cholesterol screening should begin between the ages of 18 and 24.
Riley, is everything okay?
Sir, she just rolled her eyes at us.
All right, make a show of force. I don't want to have to put the foot down.
No, not the foot.
Riley, I do not like this new attitude.
Oh, I'll show you attitude, old man.
No, breathe.
What is your problem? Just leave me alone.
Sir, reporting high levels of sass.
Take it to DEFCON 2.
DEFCON 2.
I don't know where this disrespectful attitude came from.
You want a piece of this, Pops?
Yeah, well, look.
Prepare the foot.
Keys to safety position. Ready to launch on your command, sir.
Just shut up!
Fire!
That's it. Go to your room.
The foot is down. The foot is down. Woo!
Well, we can laugh about it a little bit there, but as we see in that movie, the Inside and Out clip, sometimes our emotions get the best of us, and that's not always a good thing, especially when it comes to our hearts. Dr. Stephen Nissen is here to help us explain when we get angry, sad, scared, and joyful, what that all means and what we need to know. And being the head of cardiology there at the Cleveland Clinic, I think you might know a thing or two about this.
We do see it, and really stress is a major component of heart disease. We learned some very important lessons about this way back during the first Gulf War, when Scud missiles were being fired at Israel. There was a huge spike in the incidence of heart attack. People were afraid. When you get afraid or scared, your blood pressure goes up, your heart rate goes up, and that can cause a plaque in your coronary arteries to fracture and cause a heart attack. So stress can in fact lead to heart attack.
So stress, clearly something though I think that we all deal with in our lives. It's almost inevitable. So then the question becomes, how do you handle it to make sure that something like that doesn't happen to you?
Well, if you're under stress, what we tell our patients is the best stress reliever we know about is exercise. And you don't have to take a pill. There's no side effects. You get out and you do a kind of a brisk walk. And people who've studied this will tell you that stress levels come down when you exercise. And of course the exercise is also healthy for your heart. So that's a win-win.
So I guess the emotion of joy then, happiness, that's got to be a good thing on your heart.
It is a good thing. You know, it's not as clear that happiness is something that leads to improvements in heart health, but certainly those negative emotions have an effect. And in fact, if you undergo a loss, if you have a loss of a loved one, the stress from that can actually cause something we call broken heart syndrome. It's actually got a fancy name called Takotsubo syndrome.
Wow.
And it can lead to part of the heart muscle actually not functioning. Looks for everything like a heart attack, although it's a little different problem than a heart attack. And you can actually die from that. So you really can die from a broken heart. Yeah.
Wow. And you know, I think that's something that people often joke about, but no, it is absolutely possible. So is being that loss and that feeling, is that the same as being angry? Does it apply the same way? Or if you're angry, does that affect your heart in a different way?
Well, anger really does raise blood pressure and heart rate, and that's not a healthy thing. But you know, on the other side of the equation is the problem of depression. We've known, many studies have shown that if you're depressed and you have heart disease, you have a worse outcome. You're more likely to die, have another heart attack, have other bad things happen. If you treat that depression, sometimes with medications, but with other therapies, if the depression lifts, the heart health gets better as well. The mind and the body are interconnected. This mind-body interaction is something we've known about for a very long time. And the heart, really, you know, people talk about the heart being the kind of the center of the soul. Well, the emotions really do have a big effect on the heart.
So having that positive outlook on life in maybe stressful or scary situations, that mind over matter thing, it can help you get through things that others can't.
You have to know yourself, and we're all under stress. Every one of us is under stress. It's learning how to react and cope with the stress. If you can do that, then you don't have those big swings in your vital signs and your blood pressure, your heart rate, and other things. And you don't seem to suffer the consequences. It's not being under stress, it's how you react to the stress that makes a difference. And folks need to learn how to cope with the stresses in their life. If they can, it helps the heart.
And to look for outside help. It's not a bad thing to get help from outside of yourself. You don't have to take care of it on your own. Maybe medication, even with something like depression.
That's right. And we actually have a psychiatrist that works in our preventive cardiology group, does some wonderful work, and he's been able to help a lot of people find ways to cope. It's not always medications, it can be other strategies, as I talked about, exercise, but it's the reaction to the stressors that leads to all the problems. You know, you can't make stress go away. We live stressful lives.
Absolutely.
But you can react to it in a different way than you have in the past.
Dr. Nissen, thank you so much for being here. And now I know there are differences in heart disease, and David has an expert here to explain.
Okay, it's time to talk about heart attacks, everyone's not so favorite subject, and Dr. Wozni joins me from the Cleveland Clinic. And what kind of cardiologist did you say you were?
I'm an electrophysiologist. I'm like the electrician of the heart.
The electrician of the heart. So we're standing over here, and we're going to talk about heart attacks first. So is this an electrical problem or a mechanical problem?
The heart attack is actually a plumbing problem. So it's a problem. Plumbing problem. It's a plumbing problem, and it happens when one of these arteries gets completely occluded or closed off. And then it cuts off the blood supply to the heart muscle. And then that's what a heart attack really is.
That's a heart attack. Now this blue one, is this a vein
that's a vein. That's a vein that is draining the heart.
Can that cause a heart attack too?
That cannot cause a heart attack. The heart attacks are really from the artery that feeds blood into the heart, and then it gets closed off, and that's when you get a heart attack, or we call it myocardial infarction.
Okay, so we're talking about a heart attack. How is a heart attack different from heart failure? What's heart failure?
So the heart attack then, because there is the cutoff of the blood supply to the heart muscle, the heart muscle dies, and then if that is significant, the heart starts failing, and then you develop heart failure.
Heart failure. So okay, so now I'm having heart failure, and what I guess I want to avoid most is cardiac arrest, right?
Exactly. So heart failure is the most common cause of cardiac arrest. And now that cardiac arrest is an electrical problem. And that's when the electrical system of the heart goes haywire and basically causes the heart to arrest and stop. And that's when defibrillation helps to revive a patient.
Oh, so that's when you're putting electricity back in the heart.
Back in the heart, exactly.
Well, I'm glad I don't need that very often. Although when I had surgery, I probably had to have that to start my heart again, right?
Exactly.
So I needed a good electrician.
Yes, you needed a good electrician to get the heart started.
Thank you very much. Dr. Marc was talking about this. He was talking about pacemakers. So that's an electrical thing that helps the heart become consistent, huh?
Yes. So sometimes the electrical system of the heart gets damaged for whatever reason. The most common cause is actually just aging, and at that time we need to put a pacemaker to rewire the heart, so to speak, and the heart muscle.
Okay, so we talked about heart attack, we talked about heart failure, cardiac arrest, and now heart disease. So how does heart disease play into this?
So heart disease basically is an all-encompassing term. So if somebody has coronary disease, like we talked about, the arteries are getting closed, or if they have issues with their electrical system or their valves, it's all considered heart disease or heart failure. Heart failure is also part of the heart disease subset of patients.
I was talking to a guy the other day, and he was depressed. He said he just went to the doctor and he found out he has AFib.
Yes.
So what is AFib, and why does he have to be worried about having AFib?
So atrial fibrillation affects more than 3 million people in the United States, and it's when the upper chamber of the heart, the atrium, starts beating erratically and very, very fast. It goes very fast. It results in an irregular rhythm, and that's why patients will come with palpitations. But the reason this patient has to be concerned about atrial fibrillation is because the atrium is not really pumping, it's just quivering. Blood can stagnate, a clot can form, and that can cause a stroke. Almost 15 to 30% of all strokes are caused by atrial fibrillation. And atrial fibrillation increases the risk of stroke by 5 times. So somebody who has atrial fibrillation, the first thing they need to talk to their doctor about is prevention of stroke.
So AFib is a problem that you would deal with. Like, what other kind of problems would somebody that deals with the electrical part of the heart deal with? Like, you see one cardiologist and he says, well, you need a different kind of cardiologist.
Yes.
Who's that patient?
So the patient that comes to me is somebody with atrial fibrillation, somebody who needs a pacemaker, somebody who needs a defibrillator to prevent cardiac arrest, or that can treat cardiac arrest when it happens, and can prevent sudden cardiac death. Those are the patients that we see in cardiac electrophysiology.
Can people feel AFib when they're at home, or they know that maybe they should start seeing a cardiologist?
A lot of patients do feel atrial fibrillation, and the most common symptoms are palpitations and other nervousness, and then other symptoms that patients can experience is tiredness and fatigue and decreased endurance.
Dr. Wozniak, thank you very much.
Thank you very much.
I learned a little bit here.
Thank you.
We're going to keep on learning more. Okay, so we're going to toss it over to Natalie.
Thank you very much.
Thank you.
All right, hey, coming up after the break, I do have an update on my blood pressure to give to you. Some of you viewers are really smart out there. I made a mistake, and we'll explain that. And also, in this special of Love Your Heart edition of New Day Cleveland, we are heading into the kitchen. Meals and snacks that are heart healthy and delicious. And hey, maybe you've been through a heart attack, or you're struggling with a difficult cardiac diagnosis right now. Next, you'll meet someone who's been there, an inspirational story of success, when we return. And you can love your heart this weekend for free. You can skate your heart away on Saturday, November 11th from noon until 5 p.m. at the ice rink on Public Square. The Cleveland Clinic is picking up the tab for admission and your skate rentals as well. And get this, you'll burn 300 to 650 calories in just an hour. Welcome back. Here's another thought for you. 68% of Americans are concerned about dying from heart disease. Well, heart issues can come on slowly or suddenly, and in the case of the patient you're about to meet, timing was everything. Here's Dr. Marc.
I do not remember the day before or the day after.
March 16th, 2013, Charlene Crump is rushed to the Cleveland Clinic ER.
It was an aortic aneurysm. It had actually dissected, came apart from what we call the root to the end of the aorta.
Charlene's story is really remarkable. I don't think she had more than minutes to live.
Dr. Eric Roselli was there that day, and he realized exactly what was happening.
They wheeled her up from the emergency room with her bed in a tilt because she was really dying in front of our eyes. I just grabbed the bed and said, call the OR and tell them to have a room. Tell us what number OR we're going to. And we mobilized the team that fast within a matter of seconds. We ran into the operating room. The anesthesia team was busy getting the breathing tube in. We didn't even have time to actually get her asleep in the usual way. I made an incision with honestly barely prepped in the way we normally do and put tubes into her artery and her vein in her groin, and we got her on the heart and lung machine immediately.
Crump was stabilized.
And then we all took a deep breath. And we said, okay, let's get this cleaned up and get her prepped the right way. And we were able to proceed with the operation we do normally when we do those emergencies.
10 hours of surgery would follow.
They call me a miracle. They can't believe that I even survived.
And the operation went beautifully, and she had a great recovery. And as you've seen, She's just done wonderfully well.
Today, Charlene's life has changed.
To be honest with you, it has changed for the better.
With her best friend Keith by her side, she's healthier.
Salt intake, I don't, deal with salt anymore. By sugar intake, more healthier diet. I've lost weight, and I'm at the gym like 2 days a week, and I will continue to lose more weight. Today, I feel pain-free. I feel very good.
And she's grateful.
Total gratitude for the rest of my life. It was just divine intervention, and him being there saved my life.
I mean, I didn't save her life. Our team saved her life.
He's so modest, he doesn't even take the whole credit for it. So I want to say thank you to his team at the Cleveland Clinic that saved my life.
Everybody knows it's easier to eat heart-healthy meals when they taste good. That's right, and that's why the clinic has sent over a great recipe along with some great people to help us here. How are you today?
I'm great. How are you?
So you're a dietitian?
Yes, at the Cleveland Clinic.
And this guy is?
Not a dietitian,
He's famous.
but I love to eat.
Well, it's great to have you here. And somebody told me you were going to make oatmeal in a slow cooker,
Yes.
which to me sounded like...
It's amazing.
Yeah,
Yes.
sounds crazy, but it's good.
So many of our patients tell us, I don't have time to eat breakfast, so I just skip it. But you're missing out at a great time to incorporate more fiber. So in the morning, actually in the evening, you can take overnight oats, dump them in the crock pot, ready the next day. You start with steel cut oats, slice up a few apples, walnuts, and our MVP, chia seeds. Most people don't even know. Yes, most people don't even know what they are, but it's like the Cadillac of seeds.
They're the ones that get stuck in your teeth.
Exactly, they do get stuck in your teeth, and they kind of form a gel because they can hold 10 times their body weight in fluid, so it's great for hydration. 18% of your day's worth of calcium can be found in one serving, and per ounce, they contain more omega-3 than salmon.
Okay, Colleen, so when this in here, is this already completed?
Yes, we made it last night, so we dumped these ingredients in the crock pot. They sat for 8 hours.
So we
do a little scoop.
if we take this out, like put it in a dish, right? Okay, so we put it in a dish. Now, what would you put with that?
So you could slice up fresh fruit and put it on top. It's actually a full meal in one crock pot, so you actually don't have to add anything.
Dr. Mark, what do you think if you were making this, if you threw in, like, could you throw in raisins?
Sure.
Could you throw in dried fruits like dried apricots,
Absolutely.
that kind of stuff?
Nuts.
I would love raisins. You could also put fresh strawberries, I would think.
Sure.
I mean, this is going to be very high fiber, like you said.
Yes.
Calcium. I mean, this is super heart
Rich in
healthy.
omega-3.
One of the cardiologists was telling me a little bit earlier about the importance of fiber in your diet. How does fiber affect your diet or your cholesterol and your heart health?
Fiber will lower your LDL cholesterol a little bit, which is nice. It also is not heavy in simple sugars. You know, like when you eat some of these Pop-Tarts and things like that.
Oh, yeah.
Those are the kinds of sugars you don't want, or the kind of carbs you don't want. Plus, this is going to keep you full for a while. It'll make you last till lunch,
Yes.
won't it?
Yes, easily.
And the great thing about this too is if you start it at night, you wake up in the morning, it smells so great.
Yes.
Yeah.
And it's ready. You just scoop it and we're done.
It gets you off on the right foot.
No excuses.
Can you drink coffee and have this too?
I say yes. What do you say?
Yeah, I say absolutely. Coffee is fine for you. And actually, coffee is more than fine. I need a cup of coffee in the morning.
I do too. So a little coffee and a little steel cut oats and oatmeal would be terrific. So now we're moving on to lunch or dinner
Yes.
after breakfast. What's going on here?
Okay, oatmeal black bean burgers, a great alternative to red meat. They are so easy to make. In fact, if you don't mind, I'd like to make them now.
Let's do it. I like it. We need a little noise in here, right, Dr. Mark?
Yeah,
Okay.
absolutely.
1 cup of cilantro,
Okay.
1 cup of carrots. Don't worry about these falling on the side.
They're round. They're hard to keep up.
That's right. Can of black beans, a little bit of fresh garlic, green onion. All right, and a can of tomatoes. And the best part about this is that when we blend it, once it becomes a liquid, you can actually melt 2 cups of rolled oats into these burgers. It helps absorb the liquid. And we know that, oatmeal contains...
This is the hardest thing about
It's
cooking.
the hardest part about cooking.
I'm
It's
not
not
kidding
even
you.
the food itself.
It's the one thing that's hard for me to do too.
It's good. Yeah, I don't know. Any ideas here?
Yeah, I got a little idea.
Okay. Oh, yeah. Oh, nope, that wasn't a good idea.
I felt so cocky too.
I know. We're almost there. Oh, maybe? Yeah. Okay. Anyway, oats contain beta-glucan.
I'll hold it.
Okay.
I'll tell you what, Colleen
right.
Bogdan is a dietitian, but that doesn't necessarily mean she can
Doesn't
run
mean I'm a chef.
a food
And-
processor, right?
Yeah, exactly. And it's not even turning on.
It won't go on because this won't go on until you put it on.
Anyway, once you blend this, you can mix it. Yeah, all right.
I can't fix your heart, and I can't pick a great diet, but man, can I run a food processor. So is that enough?
plenty. That's plenty. Once
Okay.
it's liquid, you can let it sit for a few minutes, and then you mix in 2 cups of rolled oats. It helps kind of absorb the liquid. And we know that oats contain beta-glucan, a special type of fiber that kind of gels in your stomach, sticks to the cholesterol, and helps you remove it from the body. So.
And how do you cook this? So once you've got it made.
Once you mix it with the oats, you
Is it a
kind of
good
form it into
question?
little patties. It's a great question. Once you put the little patties on a sheet, you can bake them at 400 degrees for 8 minutes, and here's our end product.
And let's see. Let me open one of those babies up and see what they look like here. Yeah. I've got a little knife here. You never use a knife like this, do you?
Our instruments don't look quite like that. I'm going to trust you with it.
I bet they don't. But there's what it looks like.
They're great. You could add avocado on top, guacamole, salsa, hummus. Ooh, you're brave.
And?
Pretty good, right?
I feel healthy.
You are.
You look healthy.
You are.
I love
great.
you.
Yeah.
I love you. I'm healthy because of you guys, tell you the truth. And I should tell it to everybody. The Cleveland Clinic, man, they put my life back in shape. So that is terrific. Thank you very much.
Great.
You're a wonderful dietitian.
Thank you for having
We're
me.
going to work on the food processor skills.
We'll get it next time.
We'll get it next time. Okay, coming up, Dr. Mark answers your heart questions, including whether heartburn indicates a heart problem. That's pretty important. And here's another way to love your heart. You can join the Cleveland Clinic Heart Health Experts for a panel discussion, complete with health screenings, life-saving information, and a delicious heart-healthy dinner. It's called Show Your Heart Some Love, and it's happening on Tuesday, February 28th from 5:30 to 8:30 at the Embassy Suites in Independence. So if you want to register, just visit clevelandclinic.org/heart event. The cost is $20, and it's worth it. After the break, we'll see you. Welcome back. Okay, 59% of Americans incorrectly think that knowing one's heart rate is an important factor in calculating heart disease risk.
Interesting. All right, we have been showing you how to love your heart all hour, and now Dr. Mark is ready to answer your questions, including does heartburn indicate a heart problem, and also if heart disease runs in my family, am I destined to have it? So there's a lot of questions out there relating to our heart.
This heartburn thing, though, I know people have gone to the hospital because they have heartburn because they thought they're having a heart attack. So I want to know the answer to this.
Short answer is no. Heartburn is incorrectly named. It's not actually your heart. It tends to be more your lower esophagus, where you have some acid reflux into the esophagus, and it causes more of a sharp pain down in there. That said, if you're having pain in the chest, the first thing to do is rule out a heart problem. Don't assume it's heartburn. I mean, if you've had heartburn for years and you know you've got reflux, all right, fine. But if you're a 65-year-old guy and you suddenly develop a pain in the chest you never had before, assume it's your heart, get to a doctor, or if it's really bad, call 911, rule out the heart, and then we'll call it heartburn for you.
Is there a good description of what that heart pain would feel like in your chest, so it's different from that burn?
So the bad kind of heart pain, if someone says I have chest pain and they go like this, a squeezing pain, that's bad, that's a heart attack. If someone says it feels like an elephant sitting on my chest, a pressure kind of pain, that kind of pain, more likely to be a heart attack. But there are atypical chest pains, particularly in women. Women more than men can have a sharp pain, an intermittent or fleeting pain. Basically, any pain in the chest, any pain from here to here, think could be my heart, and rule that out first.
If you wait for it to go away, you might go away.
Yeah.
You don't want to wait for that to happen.
I mean, another way to think of it is much better to be a little embarrassed because I went to the ER than to be a lot dead because I left a heart attack to happen.
And I think that can be for anyone at any age. I can admit that the beginning of the year, I went to the ER just because I wanted to be safe because I was having chest tightness that I had never had before.
You just use that symbol that gets us alert. Yeah.
So for any age, go and seek help just to be safe.
Save your life.
Okay, well, we got a lot of questions in. By the way, we went into the break, and what was my blood pressure?
120/80, you were perfect.
120/80, see, I am okay.
You're okay.
I told you were perfect.
Well,
Far
some
from
people
perfect,
said, they texted in or on Facebook said it may have been because your legs were crossed when you checked your blood pressure. That might increase your blood pressure a little bit. It was more this. It was the white coat.
And thinking I'm about to have my blood pressure checked on TV.
On TV.
Yeah.
Fear of the
blood
white
pressure go up a little bit.
Fear of the white coat. Hey, you were talking about family. If you have heart problems in your family, is there a chance that you're going to have the same kind of thing?
Passed down.
There is a chance. And obviously, you can't escape your genes.
Yeah.
I mean, you don't get to choose your parents. So if your parents have heart disease, yes, your risk is higher than average. but still 90% of your risk of having a heart attack is controlled by what you do. Or to put that a different way, you can beat your genes. It doesn't matter what your genes are in general, you can beat them with the right habits.
That's great to know. Great to know. Okay, we have Diane who wrote into us asking, what does thickening of the heart muscle mean and what's a murmur?
Thickening of the heart muscle means that the heart muscle has hypertrophied, or you've added more heart muscle cells. When does that happen? It's almost like lifting weights. You know, if I do a lot of curls, which obviously I don't, but if I did, I would have big biceps. How do you exercise your heart to get it to be thick? High blood pressure is the main way. If your blood pressure is really high in your arteries, that means your heart is squeezing against a high blood pressure.
Doesn't make it better to be stronger.
Yeah, you don't. I would like to have big biceps, but I do not want to have a thick heart muscle because a thick heart muscle doesn't pump as effectively. So how do you prevent that? If you have high blood pressure, get it treated, and your heart muscle will get thinner.
Okay.
How about diabetes? Is that a risk factor in heart
Diabetes
disease?
is a big risk factor for heart attacks, for atherosclerosis or blockages of the heart muscles, and treating diabetes likely helps. Biggest thing with diabetes, though, is most diabetes is type 2 diabetes related to being overweight. So people who have type 2 diabetes from being overweight, if they begin to lose weight and exercise, they can make the diabetes go away or get better, which protects your heart as well.
We have Philip here who wants to know, is it true that 75% of people who have heart attacks have normal cholesterol?
Not quite 75%, it's more like 50-50. And the point of that is, if your cholesterol is normal, that is great. It doesn't mean you can eat poorly, stop exercising, and start smoking. So cholesterol is just one part of it. You want to manage the cholesterol and make sure you know it and your LDL is good, but you also want to manage the other factors.
I see people right now talking about statins. You're saying statins are good. You take statins, I take statins, everybody takes statins. But people are also talking now how there might be a problem with statins, like muscle pains and that kind of thing. Are you familiar with any of that?
Yes, I am. Yes, I am.
Yes.
I love him. He's the best.
In people who have atherosclerosis, coronary artery disease, and blockages, this is really simple. Statins save lives. Statins make people live longer. Some people do get muscle aches and pains with statins, and they feel like they should stop the statins. Don't stop them. Tell your doctor, I'm getting these muscle aches and pains, which we call myalgias. Say, my calves hurt when I take a statin. We'll switch you to a different statin.
There you go.
Or we'll change the dosing schedule, or we'll give you a lower dose, but don't abandon statins just because you tried them once and you got some aches and pains.
A lot of people do.
Good
That's
point.
dangerous.
Yeah, a lot do.
All right, Dr. Marc, it has been a pleasure having you here. He's not going anywhere. Stick around because we have more New Day Cleveland after this short break.
Sponsors of New Day Cleveland include
Welcome back. Here's one more Did You Know? 67% of Americans have taken one or more types of supplements regularly to enhance heart health. And Dr. Marc James asked us, are supplements safe to take without a physician's consent or approval?
Boy, those 67% of Americans should save their money. Spend it on something else. Buy yourself a good pair of running shoes. It's way better for your heart. Supplements in general are of no help whatsoever, occasionally dangerous. So I would not take supplements unless your doctor said, hey, you need a particular one. In general, throw them out.
That would include fish oils and all that sort of thing?
Right. You know what's the best way to get fish oil? From fish.
Eat a fish.
Have a piece of salmon.
Eat a fish.
But fish oil pills have not been proven to do anything useful for almost anyone.
I remember when I had to go to the clinic and I had some surgery, they said, make sure you don't take any fish oils before you come in. So it could be dangerous, I guess.
Yeah, a lot of these supplements, fish oil in particular, can interfere with blood clotting. And we have periodically had cases where someone was on a whole boatload of supplements and we can't stop the bleeding. So we tell everyone before surgery, stop the supplements. And for most of you out there, stop the supplements.
So big takeaways from today. Know your numbers.
Definitely know your numbers. Realize you control your heart health. You want 3 billion beats out of this baby. That's how many heartbeats you get in a lifetime. You control it. Keep it ticking.
And then I would say, exercise, right?
Yeah.
Well, it's amazing to meet all the different people today involved. A dietitian, you start off with, your diet has to be right. Cardiologist is sort of like the detective of the entire thing. And then to meet the electrician.
Absolutely.
The electric.
And your emotions. Control your emotions. It has been a pleasure having you here.
Likewise.
Love your heart, right?
Absolutely.
Thanks for joining us on the special show.